Now, 1 out of every 2 adults will develop high blood pressure, which could lead to a host of problems, including heart disease, stroke, and blindness.
So many patients, though, either can't or will not take medication. As Dr. Malika Marshall explains now, a new procedure could treat hypertension for life.
When 69-year-old David Leifer was diagnosed with hypertension 8 years ago, his doctor told him to change his lifestyle.
I tried to reduce the salt, the sodium in my diet, tried to exercise some more, and it didn't really make any difference.
The next step, a pill, but his blood pressure still didn't budge.
3/4 of people with high blood pressure don't have it under control. Either they don't know they have it in the first place, or they don't want to take pills. David was one of them.
So he enrolled in a clinical trial investigating whether a procedure called ultrasound renal denervation could safely and effectively treat hypertension. A doctor threads a tiny catheter through the groin into the blood vessels that feed the kidneys and applies ultrasound energy to disrupt the renal nerves that contribute to hypertension. It's quick, minimally invasive, and patients are one and done.
The safety record is terrific. The FDA voted unanimously in terms of safety to approve the procedure.
Dr. Naomi Fisher, director of the hypertension service at Brigham and Women's Hospital, led the clinical trial in Boston. She says the technique doesn't work for everyone, but on average can result in a drop of about 10 millimeters of mercury, similar to a good blood pressure pill.
For a long, long time, we had nothing new to offer. So for those of us who've been in the hypertension field, taking care of patients with blood pressure and really struggling, looking at the global rate of control, this is very, very exciting news.
4 years later, David remains off medication with good readings.
They're telling you there's a chance you may never need to take medication again?
That's what the hope is, and so far it looks like it's going that way.
And he couldn't be happier. Dr. Malika Marshall, CBS News, Boston.
Well, most primary care providers would still recommend lifestyle changes and medications before jumping to a procedure. However, they say these techniques do provide at least one more weapon to combat a condition that is only becoming more widespread.